Now, as Kenya looks forward to receiving the first doses of the COVID-19 vaccines in mid-February, the Ministry of Health says the country is ready to store and distribute these vaccines to the targeted groups. But the growing vaccine mistrust and misinformation could undermine efforts to reach the desired groups. And as Dorcas Wangira reports, the government is looking to use open dialogue to address the misinformation without dismissing Kenyans' real vaccine-related concerns and hesitancy.
Mid-February, Kenya expects to receive its first doses of the COVID-19 vaccines, targeting at least 1.25 million Kenyans to be vaccinated between February and June in the first of 3 phases. Dr. Willie Zahwale, the chairman of the COVID-19 taskforce for vaccine deployment and the vaccination process, says Kenya has made all the necessary preparations for the vaccine. Besides the main storage in Kitengela, there are 9 other regional vaccine storage sites in Kakamega, Nyeri, Garissa, Meru, Mombasa, Nairobi, Nakuru, Kisumu and Eldoret to serve the entire country.
Immediately the vaccines arrive, we are ready and steady to start the vaccination process. A lot of the killer diseases, the measles, the whooping cough, the pertussis, without vaccination, there would have been many deaths. So vaccines have had a very big impact in protecting and saving lives.
But even before the COVID-19 pandemic, there was already a growing global decline in vaccine acceptability and uptake because of doubts of safety and efficacy and the spread of misinformation. Having a COVID-19 vaccine that is efficacious is undoubtedly the biggest breakthrough of 2020. However, vaccine hesitancy threatens to reverse this major gain. Vaccine hesitancy isn't anything new in Kenya. Previously, there has been great resistance to the HPV vaccine and even the tetanus vaccine. How is the vaccine task force going to handle this? We spoke to Kenyans to hear their perspective.
Kwa maoni yangu sifikiri kama ni nzuri. Huenda ikawa ni dawa wametengeneza ya kupunguza watu na hatujawahi ona watu wamedungwa hiyo shindano wakaendelea na maisha yao.
Sijui huyo anakuja kututunda hiyo sindano, saa ingine inaweza kuwa hiyo sindano ni mbaya. Kama isiwe si mbaya, apatie mwenzake atundwe, nikimwangalia hivi mimi nitatundwa baadaye.
In a survey conducted by the Africa CDC last year, some of the respondents said they would not take the COVID-19 vaccine, as some believe that the disease is man-made, does not exist, or is exaggerated and does not pose a serious threat. Others think they are not at risk of being infected with the virus, while others believe that natural remedies and alternative medicines are safer than vaccines.
Vaccine ya Mkristo ni damu ya mwanakondoo Yesu Kristo. Kwa hivyo hilo pendekezo la watu kufanya vaccine kwa imani, naona hapo sio sawa.
Na sasa mtu akifanyiwa hiyo shindano, huenda ikawa sasa anawekewa hiyo ugonjwa na ataathirika zaidi.
Individuals who have had a positive COVID-19 test and are now well believe that they do not need a vaccine because they think they have become immune to the disease and can no longer be infected.
Mimi nakubali ichanjwe watu, sababu si mimi peke yangu, kuna wenzangu ambao wako nyumbani na wakisikia kama kuna tiba, tunakuja sisi wote pamoja na watoto.
So we know there are a lot of untruths that are peddled out there, and people may be hesitant based on untruths. The task force has recommended we will listen to everybody. We want to hear. Where there are untruths and myths, we will address them.
Part of the strategy is to target faith-based and community leaders who will be instrumental in spreading the right information about the vaccines. The Ministry of Health has maintained repeatedly that the vaccines will be optional, no one will be forced to take it, and that it will also be free. And most importantly, assured Kenyans that the vaccine is safe.
The vaccine is going to provide an opportunity to prevent hospitalization and deaths. But it does not mean we stop all other preventive measures. We need to continue masking, we need to continue doing physical distancing, and we need to continue enhancing our personal hygiene.
Dorcas Wangira, Citizen TV, Nairobi.